Good morning, everyone. Myself, Aishwarya Mohanty, is going to present on OCT. Can it be a predictor of eclampsia? There is no financial interest. Preeclampsia, with the prevalence of 3 to 8% of pregnancies, has become the leading cause of maternal mortality, especially in developing countries. It is a multi-system disorder which can also affect eyes and the visual system. Now, emphasizing the pathophysiology, reduced blood flow to placenta due to fibrous spiral arterioles. It results in placental hypoxia ischemia, which can lead to fetal growth restriction and in severe cases, fetal death. There is also release of pro-inflammatory proteins into the maternal circulation, leading to endothelial dysfunction and systemic vasoconstriction, eventually resulting in maternal hypertension. And due to local vasospasm, there is major organ damage like in kidney, retina, liver, and brain. Visual symptoms, which are usually most common in third trimester, include blurring of vision, photopsia, scotoma, diplopia. Ocular findings include conjunctival vascular anomalies, hypertensive retinopathy, exudative RD, vitreous and preretinal hemorrhages, ischemic optic neuropathy, and hypertensive choroidopathy. There are very few clinical studies on preeclampsia's retinal changes as the objective and quantitative retinal imaging methods were lacking. So with the advancement of OCT, an attempt has been made to study RNFL changes in pregnant women with gestational hypertension in the age group of 18 to 45 years and establish the potential contribution of OCT as an eclampsia predictor. It was an observational prospective study including all the patients diagnosed with gestational hypertension by the Department of Obstetrics. Pre-existing diabetes, hypertension, renal disease, or any other retinopathy were excluded from the study, and informed consent was taken from 35 patients after satisfying inclusion-exclusion criteria. Details pertaining to family history of hypertension, age, parity, gravida, and blood pressure were documented. Baseline data was collected. A comprehensive ophthalmological examination was done, including external examination, BCVA, slit lamp, IOP measurement, detailed fundus evaluation, and peripapillary RNFL thickness was measured at first visit at 28 weeks and 2 months postpartum by HD-OCT. The severity of PIH was classified into preeclampsia, mild and severe, and eclampsia according to ACOG guidelines. Now coming to results and discussion. Maximum of the study population belonged to the age group of 30 to 40 years, with the mean age being 32.48. The youngest patient in our study was of 20 years of old. There were 23 primigravida and 12 multigravida patients, and maximum of them belong beyond 30 years of age group. According to ACOG guidelines, there were 28 mild preeclampsia and 7 severe preeclampsia patients. On comparison of RNFL thickness from first visit to 28 weeks of gestation, in the mild preeclampsia group, 7 patients had thicker RNFL layer thickness, while 15 had no change. 6 of them had mild thinning. Likewise, in the severe preeclampsia group, 3 had no change and 4 of them had thicker RNFL layer thickness, out of which 2 patients were diagnosed with new onset of convulsions who were terminated emergently. The mean RNFL layer thickness in the severe preeclampsia group increased from 96 micron at first visit to 101 micron at 28 weeks, which decreased significantly to 98 microns postpartumly. This was found inconsistent with a study done by Arab et al. In mild preeclampsia group, there was no significant change during pregnancy and after postpartum. Now, highlighting the fundus changes, 13 patients had no hypertensive retinopathy, 7 had grade 1, 6 had grade 2, 5 had grade 3, and 3 of them had grade 4 hypertensive retinopathy. One of the study population were diagnosed with exudative RD on post of day 2 of LSCS. Similarly, Reddy reported that 53.4% of preeclampsia and 71.2% of eclampsia patients had retinal changes. These vascular changes in the retina, they typically correlates with the severity of systemic hypertension. Therefore, observing the retinal changes can help in assessing the disease severity. To conclude, I'd like to say that preeclampsia was more prevalent among the elderly primigravida in this study. Severe preeclampsia had thicker RNFL layer thickness during pregnancy, which decreased significantly postpartum. At the same time, there was no change in mild preeclampsia. An OCT with ocular fundus changes may be useful in predicting the maternal risk, diagnosing the patient early, and it can guide the obstetrician in early and prompt management. So, therefore, fundoscopy is highly recommended in all these patients, especially in elderly primigravida during the antenatal visits, and there should be frequent follow-up. Secondly, HD-OCT can be used as a routine screening tool in all these patients before any vision-threatening complications.